We also recognize the Métis, Inuit, and other Indigenous people across Canada. We do this to reaffirm our commitment and responsibility to improving relationships between nations and to cultivating our own understanding of Indigenous peoples and cultures. Please join me in reflecting on the harms done to Indigenous peoples, such as the cultural genocide and assimilation of Indigenous peoples, the residential school system, and recovery of graves of Indigenous children, the too many missing and murdered Indigenous women and children, and the social inequalities and racism which exist today. I invite you to think about the responsibility we each have to act in a spirit of reconciliation, healing, and collaboration. Now, we had a bit of a change of our agenda, so do you want to show the video now? Great. Okay.
Serving 875,000 people, Island Health's focus is the health and wellness of the residents and communities on Vancouver Island and in surrounding coastal communities. Our diverse geography spans 48 settler communities and 50 First Nations, from the Zawadenu people of Kincombe Inlet to Victoria, from Tofino to Comox. We acknowledge with respect and gratitude our privilege to provide health and care services on the traditional unceded territories of the Coast Salish, Kwakwaka'wakw, and Nuu-chah-nulth cultural families. The Island Health family includes 27,000 healthcare professionals and 1,000 dedicated volunteers. 2,900 doctors, nurse practitioners, midwives, and dentists make up our medical staff. We provide health and care services at 145 facilities, with more than 6,600 long-term care beds, nearly 1,400 mental health and substance use beds, and more than 1,800 acute care and rehabilitation beds. Island Health has an annual budget of $3 billion. Each year, this funding supports 491,000 visits to emergency departments, more than 73,000 surgeries, 59,000 MRIs, 152,000 CT scans, 2,100 telehealth visits, more than 51,000 visits to urgent and primary care centers, over 16,000 home health monitoring visits, and 463,000 home health care visits each year. Island Health has expanded our primary care services with 7 Island Health urgent and primary care centers, and we partner in 3 community health centers and 7 primary care networks across the region, with further expansion in the works. Under the leadership of 6 medical health officers, Island Health works to promote health, prevent disease, and improve quality of life. Each year, we conduct more than 2,000 inspections of childcare facilities, 600 inspections of licensed care facilities, and 4,500 inspections of food service operations. Public health nurses provide more than 5,000 perinatal home care visits, and in partnership with First Nations Health Authority and community pharmacies, more than 2 million COVID vaccines have been provided in Island Health. From before birth to end of life, Island Health strives to provide excellent health and care for everyone, everywhere, every time.
I have to say, I never get tired of watching that video, and it always surprises me how many services we provide to the people in the geography that we serve. So this is a public forum which allows the board to meet the people and communities we serve and they are essential to our commitment to transparency and accessibility. Our time together will help us better see what matters most to you, so we can increase our understanding and refine our thinking. As a governance board, we are responsible for the overall direction of Island Health. The Minister of Health appoints the board. We each choose to sit on the board because we care deeply about health and care. As a former nurse, Deputy Minister of Health, and Chair of Canadian Blood Services, the patient has always been central to my work. I always ask myself, is what I am doing right for the patient? Because caring for a patient is why I started working in healthcare, and I continue to support the delivery of health and care. Caring is also why every member of the Island Health family is dedicated to delivering Island Health's vision of, as you just heard, providing excellent health and care for everyone, everywhere, every time. It's now my pleasure to introduce you to my colleague directors who are responsible for the overall direction of Island Health. The board consists of 9 directors. In addition to me as chair, the board includes Alana Nast from Victoria, Ron Matson from View Royal, Vivian Hermanson from Campbell River, and Diane Brennan from Nanaimo. You'll see that we're missing a few people, and like the communities that we provide care to, things happen. So we have a person who's not well today, and she lives in Cayucot, so it's a bit of a travel time for her to get here, so she isn't here with us. That's Shawnee Cassavant. Ron Rice is a member of Cowichan Tribes, and he lives in Victoria, and he wasn't able to be here. Ann McFarland from Victoria, likewise, and Ann Davis from the Comox Valley, so they all send their regrets. We also have our local leadership and executive management team members joining us this afternoon, and I'll ask each of them, or I'll ask them to stand and give a wave. You'll hear from some of them later this afternoon. Great, thank you. We have a full program today. Island Health's President and CEO, Kathy MacNeil, will begin by providing an update on the delivery of health and care services across Vancouver Island, and in particular here in Sooke and the West Shore. Dr. Murray Fyfe, Medical Health Officer, will speak about public health and wellness in the region. We'll then have a presentation from our regional staff on some of the key services available to support people in Sooke and the West Shore, followed by a community presentation. The last part of the agenda will be an opportunity for you, community members who have come to our meeting or submitted questions by email in advance. And I will open the floor to questions so the board can hear from you. And now I invite Kathy MacNeil, Island Health's President and CEO, to provide an update.
Thank you, Leah, and good afternoon, everyone. Thank you so much for coming out today. With respect and gratitude, I'd also like to acknowledge the wisdom, culture, and traditions of the Sooke Nation, whose territory on which we gather today. We know that there's so much work for us to do when it comes to reconciliation, and we're only at the beginning of a very long journey. Every step that we take, whether it's big or small, is a step towards acknowledgement, understanding, and change. It is wonderful to be with you here in Sooke. It's lovely to see your faces. I know some are still covered, but it's nice to see people again. And it was actually very good for us to come out, and that's one of the reasons why we come out to communities, is to remind ourselves what it's like to live in community, what the drive is like, what the landscape's like, what the weather's like. So it's really good to be out here in your community. We look forward to sharing some of the work with you this afternoon underway here in Sooke and the West Shore to support health and care and your health and care in this community. Earlier today, we had the pleasure of seeing some of the work firsthand when we toured the Esquimalt, West Shore, Sooke, all three communities, the health unit, so the community health services that support this region, and the West Shore Community Health Center with our board and our executive. And I think I can speak on behalf of many of us to say how impressed we were with the dedication that we saw in the teams today. We saw how the different elements of our health and care system fit together, from community home support to primary care, delivered both directly by Island Health and also in partnership with many partners to provide ongoing care to patients and clients as they transition through the various services that they access. Like many healthcare organizations in this province, in this country, and actually what we hear worldwide, our organization at Island Health and our human resource challenges are significant. And that's why the sustainability of our people and our workforce is front and center of the work that we're focusing on. Late last year, we launched our Health Human Resource Sustainability Initiative to improve the work environment within our organization. It's a critical organization-wide priority that we will be focusing on for the next couple of years to come. We have a dedicated team. We've dedicated resources with people at all levels of the organization, prioritizing work in 5 key areas. Embracing flexible work, because we've heard from our staff, they want more flexibility in their work. Great leadership. We've heard the impact of your direct leadership and leadership in general has in the work and creating the tone and the work culture. Providing learning and career pathways so people can see a career trajectory for themselves within our organization. Flexible and adaptive care models. How can we innovate and be flexible in changing the care models when we don't necessarily have all of the multidisciplinary roles that we would want to have? And then the competitive talent program. The whole world's looking for the same workforce in healthcare. How can we draw them to Vancouver Island? What makes us special and unique? In the West Shore, the Urgent and Primary Care Center is piloting self-scheduling, one of those flexible work initiatives that empowers teams to manage their own schedules. Another flexible working option that's being explored is to support the health and well-being, such as adapting work location, duration, intensity, and hours to meet individual needs and preferences. To attract talent, we've launched several new recruitment, marketing campaigns, and enhanced our rural and remote relocation supports to attract over 1,153 to be exact, people to Island Health since September. So that's how many people we've welcomed to the organization since September, including 210 nurses and 86 allied health professionals. 5 of these positions are serving this region, West Shore and Sooke. We're also working on a new relocation and settlement support policy, improving processes around vacancies, postings, and hirings, and gathering staff input on how we can improve the onboarding and candidate experience. However, just as it's taking us some time to get to where we are, it will take us some time to address these issues. And we're working closely with our provincial government, communities, primary care providers, and other partners to address these challenges around our workforce. We are committed to our people and putting resources towards this vital work, which often requires us to think differently about how we organize and deliver our services. For example, we've seen tremendous growth in and success with virtual care technologies and solutions since the start of the pandemic, and where in communities where transportation is so challenging, we've heard so much from communities and from patients directly that virtual options have been a real improvement to accessing care. People who live in remote areas where travel is a barrier to access can meet with their healthcare provider from the comfort of their own home using the BC Virtual Visit or telehealth secure video solutions. And we heard today from the primary care, the community health center, that many patients prefer phone consultation and are opting for phone visits. Virtual interpretation services support clinicians in providing care to patients with limited English proficiency who might be deaf and blind, or hard of hearing. Remote patient monitoring uses virtual care technologies to allow clinical staff to effectively monitor patients while they're recovering in their homes, coupled with an education component designed to improve the patient's self-management. And My Health is a secure website that provides convenient 24/7 access to Island Health laboratory results, medical imaging results, and outpatient appointments. All of these solutions are helping clinicians and patients reach their care goals by trying to remove some of those barriers to access. We face the dual challenges of meeting today's needs while planning and preparing for the future. We hold the work of today and tomorrow at the same time. I want to switch now to just talk a little bit about our long-term vision and the work ahead that we need to do to help us achieve that vision. To focus our work, we've identified 8 organization-wide priorities: Indigenous-specific racism and cultural safety and humility, access to priority services, safety and practice standards, staff safety and wellness culture, the health human resource sustainability, innovation and what we call right care at right place, the COVID response, recovery, and climate change, and addressing the ongoing toxic drug poisoning crisis. We launched our strategic framework at the beginning of 2020, mapping out a destination over the next 5 years. Little did we know at that time what was about to hit us. Over the next 2.5 years, our focus was on our COVID response and now the recovery from that. With our COVID work becoming more normalized, we're incorporating the lessons learned into our strategy going forward. During the pandemic, we had to learn new ways of working together. The partnerships formed and strengthened during the pandemic are extraordinary. Bridges were built with local governments, primary care providers, Indigenous partners, and communities, disrupting traditional patterns and opening up new opportunities. At the core, health and care is about relationships and partnerships between teams of care providers and their patients, clients, and residents, between health organizations and community organizations, between communities and the people who live within them. We also know how important the determinants of health are to the health outcomes of the population. Only about 25% of health outcomes are a result of what we do in the health system. Income and social status, employment and working conditions, education and literacy, and childhood experiences are just some of the determinants that contribute to the remaining 75% of the health outcomes that support a healthy population and a healthy community. That's why today you're going to hear from our partners and for us to highlight how important these partnerships are. Here in Sooke and the West Shore, we work closely with all of our partners in the community, some of whom are here in the room, including the Sooke Nation, the Sooke Regional Community Health Network, the Sooke Family Resource Center, the Sooke Shelter Society, the West Coast Family Medicine Clinic, the South Island Division of Family Practice, the Sooke and Wanda Fuca Health Foundation, the Sooke Midwives, the District of Sooke and the strong partnership with Mayor Maya Tate, the Sooke School District, the Sooke Region Chamber of Commerce, and Sooke Hospice. We had a wonderful conversation with many of these partners earlier today, which reconfirmed our patients and clients are best served when we work together, and it also provided us an opportunity to hear where our opportunities are to do better as a system. We know this community, excuse me. I'm not used to talking that much. That's not true. People who know me know that that's not true. We know that this community has faced many healthcare challenges, both pre- and post-pandemic. One of the biggest challenges here in Sooke and the West Shore and across the province is mental health and substance use. Across the province, we've seen far too many deaths due to toxic drugs. It is truly heartbreaking to think of the 8 people lost between January and October of this year here in the Sooke and West Shore communities. Plans are underway to develop a mental health substance use hub in the West Shore where most specialized mental health and substance use services will be available locally and in person. Some of these services will include case management, nursing, psychiatry, and peer support services. There will also be individual and group, see, that's way better. Individual and group counseling and urgent short-term assessment and treatment. And if there's one thing we've heard from our many visits today, it's the need for counseling. It has been pervasive in every conversation. Island Health continues to offer harm reduction services, outreach programs, and addiction medicine services as safe prescribing options to support people in Sooke and the West Shore. We know there is more to do, and we continually work on strengthening the mental health substance use supports and services in the Western communities. Top of mind for so many people is access to primary care. We're fortunate to be in the 3rd year of implementing the Western Communities Primary Care Network. It's one of the first primary care networks that were funded. Island Health is a partner in the primary care network with the South Island Division of Family Practice and the local First Nations. From August of 2019 through to September of 2022, 12,622 patients were linked to a primary care provider in the Western communities. This achievement would not have been possible without Island Health working so closely with local partners and numerous private community providers to connect patients to providers. In June of 2021, the Health Connect registry was activated in this primary care network. Now, this registry is a centralized list of patients who are looking for a primary care provider. And I would recommend, if that is you looking for a primary care provider in this community, please Google Health Connect Registry in British Columbia and get your name on the list. 12,714 people in the Western communities are registered within the first 16 months of the Health Connect registry activation. And we're working with partners to connect them to a family physician or a nurse practitioner. We continue our response to COVID and are also vaccinating against the flu. COVID-19 and influenza vaccinations are available at 21 local community pharmacies in the area of Colwood, Langford, Metchosin, and Sooke on an ongoing basis. And I know, like you, I'm looking forward to hearing from our local medical health officer, Dr. Murray Fyfe, who will provide some more information about the importance of vaccinations this season. We are also continuing to work in partnership with area First Nations, Indigenous organizations, and local leaders to ensure our services are delivered in a culturally safe and respectful way, so Indigenous patients and their families always feel welcome, heard, and supported. Our leaders have received education on cultural safety, such as the Sanyas Cultural Training online, and we have participated in the blanket exercises. Teams continue to work on education to support cultural safety and humility, to support our care and approach to ensure we're trauma-informed. The people working in the healthcare system have been working incredibly hard. They are tired, and some of them are depleted. Many of you in this room are part of those teams, and some of you watching online. You've worked tirelessly to sustain our organization and provide care to our patients and their families. And I truly want to thank you for all that you do. While we face challenges as an organization, it's so important to celebrate the incredible achievements by many of you here today. I'd like to specifically recognize Sarah Crawford Bowl, who's the Executive Director of the South Island Primary and Community Care and Regional Lab Services. Rosalind Gillen, who we spent time with today, Strategic Director, Integrated Primary and Community Care. Jody Jansen, who's the Clinical Director of Community Health Services for Sooke, Esquimalt, West Shore, and Saanich. Mary Morrison, who's the Operations Manager, Underserved Housing and Early Treatment. It was great to spend time with Mary today. Kelly Reed, who's the Director of South Island Complex Community Care. Cambria Ernst, who's the Manager of the Primary Care Initiatives here in the Western communities. And Michelle Asada, who's the Manager of Integrated Primary and Community Care, and of course the many team members who work with these amazing leaders. Our vision and values continue to guide us. We turned to them repeatedly during COVID, especially when we were uncertain and didn't have a clear roadmap ahead. Returning to the basics, our vision of excellent health and care for everyone, everywhere, every time, continues to sustain us. The only road ahead for us is the one that we walk together, across silos and departments, across organizations, because we are all in service to the people who need us. We are committed to this vision. Our incredible teams are dedicated to caring for this community and to rising to the challenges before them. Thank you all for being here today, and thank you for letting us share the work we're doing in health and care.
Very much. And I'm not going to go to the podium now because I'm going to ask Murray to go to the podium. Dr. Murray Fyfe is here today to provide an update on the health and wellness of the population in Sooke and the Western communities. Thank you, Murray.
Great, thank you very much, Leah. And I just want to thank the board and thank the community for the invitation today to come and talk about the health and well-being in this wonderful community out here in Sooke. It's an honor and a privilege to be here on the traditional territories of the Sooke Nation. And I'm going to talk about a few public health issues that I think are relevant to Sooke and the West Shore. And we'll just start off by looking at a few health indicators for this region. So next slide, please. So a main measure or health indicator is life expectancy that you can see on this slide. And the females are shown in green and males in blue. And this is comparing Sooke and West Shore to the rest of British Columbia, which are in the lighter colors on here. So you know that life expectancy varies considerably around the province in different communities and across the country. You can see a difference of up to 10 years or even more in some parts of the country. But for Sooke and West Shore, what we're seeing on this chart is we're basically the same as the rest of the province, about 85 years for females and about close to 80 years for males. So overall, Sooke and the West Shore are really within the expected range for this part of the world. So that's good. But one thing that you do notice on this chart is that if you look around 2014, that the upward trend kind of stalled. And we actually have seen it even going downwards for males for the last 5 or 6 years. And this is complex, but there's a lot of reasons behind this, but a major driver has been the toxic drug crisis that we have been plagued by for the last 7 to 8 years. Next slide, please. So another indicator of our community health is the occurrence of various chronic health conditions in the community. And this is showing the trend for the most common health conditions, most common chronic health conditions in Sooke and the West Shore going back for 20 years. And you notice that some things have actually been falling, which is good, like hypertension. The light blue line on here has been coming down. But we have seen increasing trends in a couple of things on this chart, which are anxiety disorders and depression. And there's other conditions that are relatively stable. So why is this important, and why is it important that we follow these numbers? Well, for many people, these types of chronic conditions are actually preventable sometimes through changes in lifestyle or risk behaviors, but often by addressing the underlying determinants of health. And there are, as Kathy was mentioning, many determinants of health ranging from the income that we have, to the social supports that we have, to the housing that we live in. But I'm going to take a moment to comment on just one of those determinants of health. So next slide, please. And that is the experiences that we have as in our early childhood. So children who have adverse experiences or children who lack enriching experiences during their early years become more vulnerable. And this vulnerability is actually measured in BC on a regular basis. There's 5 dimensions that are measured using an instrument which is called the Early Development Instrument. And the colorful graphs that you can see on this page show the level of vulnerability of kindergarten children in each of the school districts around the province for these 5 different dimensions. So the districts that have the least vulnerability are shown towards the left of each of these graphs, and those that have more vulnerability are shown towards the right. And the measurement for Sooke and West Shore are shown by the gray bars, which you hopefully can see, especially if you're closer to the front here. And these all suggest that while there are children within our communities that are vulnerable on each of these dimensions, we tend to be towards the lower end of vulnerability when you compare us to other areas of the province. So that's good, but actually you can take these data and drill down to communities and to neighborhoods. And when you do that, Sooke and West Shore, like every other part of the province, we do have neighborhoods and communities where children are more vulnerable. So why is this important to look at these numbers? Well, children who are more vulnerable are more likely to develop or at higher risk of developing a range of health conditions as they move into their teen and adult years. I'm going to change gears for a moment because I don't think I could get away as a public health person without talking about COVID and respiratory viruses right now, so we'll just go to the next slide. So COVID is still with us, and it's going to be basically forever. It's with us for the long term now. And the virus has changed a lot, you'll notice over the last couple of years, and it's much more infectious than it was at the beginning of the pandemic, but it's also much less likely now to cause severe outcomes. We also have got very good population level immunity here on Vancouver Island and throughout BC because of all the infections that we've had over the past 2 years, but also because of the very high level of immunity through immunization. And as Kathy was mentioning, the updated COVID vaccines continue to be available We have them available through local pharmacies and also for the time being through public health clinics. However, what's more concerning than COVID right now is the surge in other respiratory viruses that we're seeing this fall and going into the winter. And in particular, the big concern right now is influenza A. And you can see from this graph that influenza A has been steadily increasing on Vancouver Island, which is shown in the red line. And also, you may have trouble seeing, but it's increasing in the West Shore and Sooke shown in the green line. And the numbers that we're seeing are earlier this season and higher than we have seen in the last 10 years. And there's an especial concern right now for children. We're seeing very high morbidity in children at this point in time. So we do have influenza vaccine for the last couple of years, including this year, available for everyone in the province of BC. And it is in particular being recommended for children right now. And the vaccine is available through public health clinics, through pharmacies, and also through primary care centers. I just had a look at the numbers before I came here, and about 40% of the population in Sooke and the West Shore so far this year have been immunized, so we do have some room for improved protection in our community. Next slide, please. When we're talking about COVID, just as important as the effects that it had in terms of causing illness are what we're calling the secondary impacts of the COVID pandemic. And these are a result of the public health measures that were put into place and resulting from things like social isolation and loss of income and interrupted educational opportunities. And these secondary impacts have been assessed a couple of times now through a public survey called the COVID Speak survey that many people may have participated in. And some of the results from this are shown on the slide here. Just forget about the arrows because they're a bit confusing, I find, but what we've been finding is that there has been a loss of a sense of belonging to community, less connection with friends, worsening of mental health, and feelings of hopelessness. And this is really important because social connections and connections to one's community are very important determinants of health that we have been talking about today. So the COVID Speak survey is going to be repeated again in a couple of months from now, I think in February, and hopefully we're going to see some improvement in some of these indicators that went the wrong direction during COVID. Next slide, please. So one of the main secondary impacts of the COVID pandemic is what it's done to our toxic drug crisis overdose, as Kathy was mentioning. And this is really a difficult graph to look at because these are not just numbers on here. Every point here represents people. These are people who have tragically died over the last 10 or so years from this very difficult situation. And many families and friends have been deeply impacted by this, some of us in the room today. So that what we were seeing was progress on the overdose crisis. As you can see on the chart here, in 2019, where the numbers started to decrease before the pandemic hit, and things have just gotten worse since the pandemic started. And in 2020, the numbers began to rise on Vancouver Island and in Sooke and West Shore, probably as a result of isolation and all the stresses that people were feeling as they were going through the pandemic. And now, while the deaths have been continuing to increase on Vancouver Island, we actually have seen a turn this year for the better in Sooke and West Shore. The numbers are starting to come down again a bit. Now, there are a number of multiple strategies that are being implemented by Island Health and by our partners to reduce this increasing trend. But as well as care and treatment, we do need to pay attention to some of the upstream prevention of factors that lead to problematic substance use in the first place, particularly for young people. Next slide, please. So that's why I really want to recognize the work of the Village Initiative in Sooke and the West Shore. This is a network of over 40 partner organizations that are working towards a vision of healthy and thriving children, youth, and families. And the purpose of the Village Initiative is to bring these organizations together to collaborate and coordinate between the partners on key issues facing children and youth. They are working towards a number of priorities, I understand, and Island Health is at the table with the whole group. And some examples of the work that is underway include mental health promotion strategy and a strategy that's in development for the middle years. So this type of initiative has great potential to increase youth connection to communities, schools, and to caring, supportive adults. And this connection does help youth develop resilience to a range of health risks, including problematic substance use. So this really is some very exciting work and collaboration that's taking place right now. I also want to acknowledge the valuable role that the Sooke Regional Community Health Network is playing. Some of the priorities that they're working on, including mental health promotion, reducing homelessness, youth engagement, and well-being seniors, are all very important around addressing the underlying determinants of health. Next slide, please. So I'm going to change gears completely here now and comment on a couple of topics that are related to the environment and health. And the first, as we're all aware, is climate change and extreme weather that we have been through a number of events over the last several years. So first of all, starting off with the heat dome in June of 2021, this very ominous looking slide here, or map here, shows the extreme temperatures that we had on the late afternoon of June 28th last year. And some parts of the CRD, including in the West Shore, were getting up well over 40 degrees Celsius. Now, tragically, there were 48 people on Vancouver Island who lost their lives from heat-related illness during this, and even many, many more throughout the province of BC during this 5-day event. And many more required care in our health facilities. So this was a very devastating and widespread event, and something that we have to be prepared for, because we're going to be seeing more of these events. Next slide, please. Another ominous looking map on the left here. This one is showing drought conditions that we have experienced over the last 2 summers on Vancouver Island. The dark brown color on the map that covers Vancouver Island means that we reached level 5, which is the most severe level of drought that you can have in BC. And why is this important? Well, we have drinking water systems that have been getting into trouble for the last couple of summers. Last year we did a survey and found out that 16% of our water systems were getting low on water as the summer went on. And drought can also have an effect on our ability to irrigate our crops and food security, and may also impact fisheries. And then third, over on the right-hand side, we had the atmospheric river event last November, which impacted numerous drinking water systems through introduction of contaminants. Homes were flooded, people were displaced, and we saw roads flooded out, including Sooke and East Sooke roads. So these are just a few examples of why we need to take climate change seriously and collectively work to reduce the impact that it can have on our health. And I just want to recognize the work that the District of Sooke has been doing on a climate and mitigation adaptation plan that they're working on, and their official community plan, which is addressing reducing greenhouse gas emissions and protecting the natural environment. Next slide, please. And then finally, just one other topic that I think we need to continue to address is around transportation. And then again, this has come up in conversations today. This graph is showing how people commute each day, mainly to their workplace, comparing Sooke with the rest of the Capital Regional District. So residents of Sooke use their automobiles more frequently and are less likely to use transit or active transportation, such as walking and cycling, compared to other areas within the Capital Regional District. So why does this matter? Well, active transportation contributes to lower rates of chronic disease, and it improves air qualities within our communities. And active transportation also helps improve connections between people and improves a sense of community vibrancy. Next slide, please. And another important aspect of transportation is traffic crashes and traffic-related injuries. And the graph on the left here shows that for both Sooke and the West Shore, and actually all of Vancouver Island, there seems to be generally a downward trend in crash-related hospitalizations, which is good. The numbers for Sooke and West Shore do bounce around a bit, but I think you can see that there's a downward trend there. However, the pie graph on the right does show that vulnerable road users, so pedestrians, cyclists, and motorcyclists, make up a higher proportion of injuries than they actually should when you consider the road share that they have. So this speaks to the need for us to continue to improve safety on our roads, and particularly for those who use active transportation. And again, I just want to really recognize the work that is outlined in the official community plan in Sooke to change our modes of commuting and make roads safer. Next slide, please. So a way to make transportation safer is through the Vision Zero approach, and this is an approach that is different than our traditional approaches to road safety in that it looks at traffic injuries as being preventable rather than considering them as unfortunate accidents. And it also looks at the whole traffic system rather than putting the focus on individual responsibility for safety. And it acknowledges that road users are going to make mistakes and that the whole system really needs to accommodate for mistakes that people might make. So we do have some Vision Zero grants that Island Health is working with our provincial counterparts on to make available to communities. This started last year. And the photo on the right-hand side here is an image of one of these safety improvements that was funded through Vision Zero grants this year in Metchosin. It is the trail crossing of the the Galloping Goose Trail over Happy Valley Road in Metchosin, just acknowledging the work that the Sooke Council did in putting this application together and implementing these changes. So there's a call out right now for grants for Vision Zero. And if there is interest, the link here is how you can access the page for how to apply for the grants. And it closes in the middle of January, so anybody that's interested, please do check into this, or you can let me know and we'll make sure you get connected with the right resources. Next slide, please. So that's all of my material. I just really want to thank you for your attention and your interest in improving the health and well-being of this community. And back to you, Madam Chair.
Thank you very much, Murray. Public health is one of those areas that we don't appreciate enough on a day-to-day basis because we forget that the reason we have clean water is because of public health, and that they monitor our air so that we have clean air to breathe and all those kinds of things. They make sure we have vaccines available to us when disease comes our way. So Murray, you and your colleagues are very important to the work that Island Health does. Thank you. And Kathy mentioned Sarah Crawford-Bull earlier on. So we're going to move to a very special presentation on local services, including mental health and substance use supports in the Western communities. Sarah is the Executive Director of Integrated Primary and Urgent Care. Welcome, Sarah.
Thanks so much. Boy, tough acts to follow here. Wish me luck, people. All right, thanks very much for being here, everybody. It's an honor to be able to be here with you today and to be here with a number of the partners that I work very closely with to support services in the Sooke Health region. I really want to thank also the members of the public who've come here today to demonstrate your support for health services and the community, and most specifically, the future of the community of Sooke and beyond. Next slide, please, Tyler. So Sooke, as mentioned by Kathy and Dr. Fyfe, we faced many challenges over the last few years. Many of us have loved ones, family, friends, neighbors, and community members who've been impacted by the COVID pandemic, toxic drug poisoning, and or the unprecedented human resource shortage experienced by many sectors of society. However, over the same time period, we've experienced people coming together in support of one another in ways that we've not seen before. Here in Sooke, we've developed stronger relationships between Island Health and many community partners. This partnership and collaboration has allowed us to work together differently to better meet the needs of the growing community and the evolving and complex needs that we're experiencing today. Let's talk a little bit about growth for a moment. I know some of these things were mentioned by Dr. Fyfe, but the area including Sooke, Colwood, Langford, Highlands, and Metchosin is the fastest growing community than any other area in Island Health. The majority of this growth is in the population of people over the age of 75, and our neighboring community of Langford is the fastest growing community in the province and the third fastest growing community in the country. That's significant when we think about health services planning that we need to engage in order to make sure we're serving the needs of the people. Specifically for Sooke, Statistics Canada data tells us that the Sooke population has nearly doubled since 2001 and is expected to increase by 33% in the next 10 years. Most notably, we'll see an increase in the population between 45 and 65 and over the age of 75. In many other areas of the island, people are living longer, and the need for well-planned, well-coordinated, and integrated services is absolutely paramount. Next slide. This slide is very important to me. It's all about the partnerships. In order to meet the needs of the Sooke community, we know we're stronger working in partnership together. There are many teams and individuals advocating for the people of Sooke and working tirelessly to identify and fill the gaps in health services. We know it'll take us all. We've met some incredible volunteers today as well, touring the food bank downstairs. I still feel really moved by the people who are down there doing such an incredible job to support this community. Whew. We have a Sooke Healthcare Committee composed of many partners who are here today, and we come together regularly to address the needs of this community. We look at data, plan evidence-informed strategies, we look at health promotion, injury prevention, we pull together stakeholders and experts in order to help us plan and implement needed services and programs. The wordle on this page was pulled from a recent planning session that we held. The session was aimed specifically at improving mental health and substance use services in Sooke. And I love how partnership was the biggest word, most spoken of sentiment in the session. This slide also represents some of the many partners that we have the opportunity of working with, and I'd like to recognize some of those people. We have patient partners. Where's Leighton? There he is. Leighton, thank you. We work together a lot. I'm sure you're tired of hearing my voice, but he helped us plan today, and he is never afraid to put up his hand for tricky and sticky issues and help us to map out complex challenges. Our caregiver support team, Barb. Are you still here, Barb? Where are you? Oh, thank you, Barb McLean. She participates in our primary care network meetings and really helps to make sure that the patient, the client, and their loved ones are at the center of the conversation. Sooke Nation, Rose can't be here today. She has a full day session, but she is also very present in our primary care network conversations and critical to that work moving forward. District of Sooke, thanks, Jeff, for being here on behalf of Mayor Tate. Mayor Tate and I co-chair the Sooke Healthcare Committee, and she is an incredibly courageous woman. Oof. We talked a little bit about women leadership earlier today, and she is an incredible leader and an advocate for this community in ways that I've never seen before. West Coast Family Medical, South Island Division of Family Practice, and the Western Communities Primary Care Network, all teams that we work with really closely. Dr. Anton Rabin and Dr. Robin Saunders are just two innovative family doctors that I have the privilege of working with. And then to our community partners, Searchin, you'll be hearing from them a little bit more today, but Rick, who can't be here today, Mary, Anna Meek, and Nikki, another member of our Sooke Healthcare Committee, is here, and I'm just so honored to be able to work with you and watch the incredible talent and strength and collaboration that you demonstrate all the time to be able to move healthcare services forward in this area. Thank you. Well, there's been a strong foundation of community partnership in this area for over a decade. I've seen growth and change in the last couple of years. And really, it's about us working together in new ways to make healthcare more accessible, to make it more intuitive, to reduce barriers for those people who have challenges accessing healthcare in a way that feels psychologically safe and culturally safe. And we know that we have a lot more work to do. With a growing community in a post-pandemic world, we know we have to do things differently. We're focusing on some key strategies to help improve healthcare access and services today, while, as Kathy mentioned, setting us up so that we can ensure we meet the needs of the community tomorrow. What we've heard from our Sooke partners, the community members like yourselves, is a need to focus specifically on a few key areas. We need to make care easier to access. We need to expand services and bring some specialized services from the downtown Victoria core out here into Sooke. We need to place clients, patients, residents at the center and ensure that we're supporting them to be active participants in their healthcare journey. We've also heard a need to focus specifically on primary care and mental health and substance use services. All of these are areas currently receiving additional focus, and I know a number of our partners are engaged in this forward momentum. Specific to primary care, we know for many people it's important to have access to primary care, including a long-term relationship with healthcare providers. Health promotion and illness prevention support is also important. Episodic and urgent access to assessment, treatment, and care from birth to end of life. As Kathy mentioned, in the Western Communities Primary Care Network, it's been in place since 2018, but significant advancements have been underway since that time. One of the most innovative, maybe I'm a bit biased, but one of the most innovative and proactive primary care teams on the island is right here in Sooke with West Coast Family Medical. They know that we can't rely on one single healthcare provider. We have to do it as a team. And that's going to rely on us as care providers to help better understand how we enhance our own scope, while also helping members of the community understand who and how to access care at the right time. Thanks to Ministry of Health funding, Island Health was able to support the expansion of this clinic in 2020, plus adding in a number of care providers, including a nurse practitioner, 3 registered nurses, a dietitian, a social worker, administrative support, and of course a key member of the team, the mental health and substance use clinicians. Very hard to recruit to, but recruitment is underway and we'll see those people in place very shortly. West Coast Family Medical is maximizing the scope of the entire team and working together to ensure the best possible support for the community. This, coupled with Island Health's plans to improve integration with public health, community health services, and also improved access to health screening, childhood development support, youth, and those living with illness and disability. For mental health and substance use services, Western Communities has, as mentioned by Dr. Fyfe, Western Communities has a higher incidence of many mental health conditions compared to Vancouver Island averages, specifically mood and anxiety disorders in youth and adults. Our mental health and substance use team has recently made steps toward expanding needed services and bringing prevention, early intervention, treatment, and recovery services closer to home. We've decentralized mental health and substance use services from downtown Victoria to support those prevention and case management activities in the Western Communities and Sooke. We've embedded local mental health and substance use and navigation supports within primary care in the community. We've added enhanced outreach, youth outreach, addictions and peer support services, as well as additional counseling services through the Sooke Family Resource Center and Pacific Center Family Services Association. And we've got work to do. Thanks, Tyler. What I've tried to highlight here is how much we value collaboration with patients, clients, and community partners. These relationships are the foundation to support a healthy community now and into the future. Island Health will continue to be a partner at the table, an active partner, to further improve health and care in the Sooke community. Thank you for being our partners, my partners. Thank you for your work to date, and particularly thank you for your ongoing collaboration. This is an incredible community, and it's an honor to work in service of you, your families, and the neighborhood. Thank you.
Thanks, Sarah, for emphasizing the importance of partnership and collaboration. As you've said over and over again, there's no way we could do this work without partners and collaborators, so thank you very much for that. And now I'd like to welcome a community presentation. So I'd like to invite Mary Dunn. Board Chair of the Sooke Region Community Health Network. And Mary, is Dr. Bryant with you?
Dr. Bryant is here, and
Oh, perfect. Oh, he's going around. Okay, great. And Dr. Chris Bryant, who is co-chair of the Sooke and Juan de Fuca Health Foundation. So welcome to you both. We're looking forward to your presentation.
thank you. As I was introduced, I am the president of the Sooke Region Communities Health Network, and we've been part of this community in one form or another since 2001. And we are working in collaboration with lots of the organizations to get things done. A couple other members of our board are here. Annemiek is our vice president, Christine is our executive director, and Leighton is no longer with us, but was a member of our board for many, many years. So thank you for coming today. We can do the next slide, please. So we just want to acknowledge again that we are also, sorry, I'm just having issues with Wi-Fi wanting to connect me, so let me get rid of that. Okay. That we are also working and in the traditional territories of the Skynu, Sooke Nation, and Pacheedaht. The district that we cover is from East Sooke to Port Renfrew, so it is quite a large district, and we are very grateful to have partners working with us in those districts. Our mission is to have healthy, thriving communities within the Sooke region. That's our vision, sorry, and our mission is to support healthy lives in healthy communities through innovative, collaborative development and improvement of services for everyone. We are a social services charitable organization, a social services cooperative rather than a society, and we are governed by a board of directors that are from various members of our community. We have board members from Sooke Nation, we've had board members from Sooke Nation, board members from Sooke Shelter Society, Edward Milne Community School, members with backgrounds in law, in public health, and in health administration. So a good variety of members on our board. I'm going to talk to you a little bit about our areas of work, and then I'm going to talk more about where we're hoping to go in the future. So we started doing community health assessments, looking at what are the needs in Sooke, what organizations are helping support those needs, and where are the gaps, and how can we work together to fix those gaps and strengthen each other's work in the community. In doing that, we found that there were a number of issues. One is seniors issues. For a lack of senior services in Sooke, we have not had a seniors drop-in center for over a dozen years in Sooke, and there are not many organizations in Sooke providing those services. As mentioned previously, the need for that care in Sooke, as it is a growing population in our community. The improvement of health services, increasing access to health services, addressing homelessness and housing insecurity, and participating in getting people together who are providing supports in our community in other organizations and supporting each other in the work that we do. We also run the volunteer center and the seasonal tax clinic for people who are on low income. Over COVID, we did do a number of community consultations. So pre-COVID, we did a consultation on managing at home, and this was looking at what do seniors need to be able to age in place? What is it that they need to be able to stay at home, stay independent, and have a good quality of life as they age? In 2016, we did a health summit. We had over 100 seniors attend that, where we looked at what their needs are. And from that, we developed some proposals and were successful finally in getting the Better at Home program in Sooke. So the Better at Home program provides non-medical support for seniors who are living at home. Light housekeeping, help with yard work, friendly visiting, someone to check in on you, and just make sure that you're okay. We are not allowed to provide medical services within that. In 2019, we facilitated assessment on disability. The province was undergoing that to look at what is it that we need to increase the accessibility within our communities. 2020, we did a study on homelessness in Sooke. called Amidst the Paradise. And so it looked at what is the actual need of homelessness in Sooke, what are our numbers actually, and also the hidden homelessness, the number of people that are on the verge of homelessness, and which really came to light over COVID because of the decrease in employment, the increase in rents, the increase in costs of living. A number of people who were squeaking by previously are now finding themselves in homeless situations, as well as a food security report. We also looked at what are the needs of our youth in Sooke. As we're moving forward with our programs, we wanted to address all the needs in Sooke. These studies were difficult. The homelessness, the food security, and the youth services were all done during COVID. So we had some challenges because we could not go into classrooms. We could not connect directly with people. We had to use a lot of different ways of trying to get this information, but we were able to get that information. As a result of that, we do have a couple projects that we are working on. They also tie to the information that the District of Sooke was able to receive. So they did a survey on what the housing needs of Sooke are, and it clearly showed one of the highest priorities in Sooke is housing for seniors, affordable housing for seniors, and more than affordable, subsidized housing. We have a number of seniors, I think we heard during the luncheon, number of seniors that are starting to try to access services from the food bank and from the shelter because they can no longer afford their places of living, and that is very sad. So we are working on developing a project in Sooke. I think we can probably move into the slides. Sorry, I'm not very good at following presentations. But we are providing work in Sooke to look at developing what we are, for lack of a better term, calling the Elders Complex. So this will be a facility where we will have subsidized housing for seniors age 55 and over. We're going to have somewhere between 75 and 79 units, but more importantly, we're going to have the services that the community needs to be able to age in place. It'll be the home of the drop-in center, which is being called the Gathering Place. It will have intergenerational programming, hard word to say, so that we can start making connections between our youth and seniors. And those are connections that we've lost as our community has become more isolated. We are also going to have all of our services there, so the non-medical supports. During the last 2 years, we have amalgamated with 2 other organizations. That's the Sooke Seniors Activity Bus. So that bus will run out of our center, and it will take people on outings. It'll take people for shopping, to see the Christmas lights, to go to the plays, to access services that they haven't been able to access. Meals, we'll have a community kitchen. So we will provide meals. If people want to cook their own, they can. If they don't, they can come downstairs and have a meal together with the rest of the community. Space rental. Anybody who knows Sooke knows it's hard to find a place to have a meeting, run a group, have a celebration. There is no space in Sooke to rent, period. So we will open up our center for those services as well. And we have had initial discussions with Island Health about having it as a place to run the adult day program, as well as a community bathing program, which we hear from Home Support is hugely needed in the community. These services will be available to the people who live there, but will also be available to the entire community. One of the things we know from surveys done, assessments done in other parts of the province, is that by increasing social connectedness, we can actually decrease dementia by 40%. It doesn't have to be a lot. It can be playing games, it can be having a meal with somebody, it can be having that friendly visitor come and see you. 40% reduction in dementia is huge. It increases our mental health, decreases depression. It also keeps us safe. It decreases the risks of falls, decreases the risks of hospitalizations, and most importantly, it decreases the risk of early entry into facilities. We know that at least 20% in long-term care right now don't need to be there if they had the support at home. We also know, as I personally found out recently, the cost of that care at home is phenomenal. It's huge, $17,000 a month if you need support to stay in your home. And that is really unattainable. So finding ways that we can prevent those needs and support people where they are is huge. Community Health Center, we're working with Island Health, the Ministry of Health, West Coast Family Medical Clinic, the District of Sooke, to try and develop a community health center in Sooke. So West Coast Family Medical is the ones that are hugely behind this. They want to see this happen. As a not-for-profit charity, we would be the governing body of that. We see this increasing the services to Sooke by providing urgent care services after hours and on weekends. By increasing the number of primary care providers, we can increase attachment. So we're hoping within the first couple of years to be able to increase attachment by about 5,000 people. And then the addition of services for mental health and addictions, and providing those services in an outreach way. So having mental health and addictions specialists, whether it be social workers, physicians, nurses, that can actually go out into the community and provide those services there. We heard today, and we know that some of those people do not feel comfortable coming to the clinic. But there are also people that are in our community that want to receive those services in the community. So having that access where people are comfortable getting it is highly important. Health promotion, that's my promotion band, right? Let's get that work out there that gives people the supports to keep themselves healthy. And doing all of this in a culturally safe way. So we need to have that cultural safety worker on staff that makes sure that we do allow that to happen. As is mentioned many times before, none of this could be done without our community partners, right? And what you see before you is a list of some of those partners that we've worked with over the years, and those partners continue to expand as we take on new projects, and we're very grateful to the work that they've done. And just as an example of that, when COVID struck, we had a homelessness committee in Sooke. We had no services. We barely had a cold weather shelter, an extreme weather shelter. And it was 10 miles out of the community, and people had to know to get the message to be at a certain place at a certain time to catch the bus to take them out to that community. It didn't work. So when COVID struck at that committee, we looked at what can we do to help our homeless. They are one of the most vulnerable in this situation. And so Sooke Shelter Society opened up, Search and opened up in partnership with Sooke Shelter Society, the COVID homelessness shelter in Sea Park. We worked with Sooke Shelter Society until they were in a position to take that over, and they are now very successfully running that shelter out of the Hope Center. People have moved from a shelter to some permanent housing within that center and are working their way towards being able to live independently outside of that shelter. It also has some space for extreme weather, but not a lot, and it will be a hub for services for mental health and addictions in Sooke if we can get the funding to sustain it. The funding they have so far is 1 year at a time, so it's not that sustainable. But we couldn't have done that without our partners, without Island Health, without Sooke Shelter Society, without all the partners that, Food Bank, the Sooke Food Bank, that stepped up to say, let's help you get this done. So thank you, and I'm just going to turn it over to Dr. Chris Bryant. Chris is one of our dentists in Sooke and co-chairs the Sooke and Wanda Fuca Health Foundation.
Thank you. With that introduction, I won't spend any of our time belaboring who we are. We're here to support. That's what the Sooke and Wanda Fuca Region Health Foundation wants to do. We raise funds. We're a publicly owned, publicly funded health foundation, and we raise funds to invest in support of health and well-being in our community. Our community stretches from Beecher Bay to Port Renfrew, on the traditional lands of the Sianu to the Pachita people, and including Sooke as well, and everybody else who's in those lands. We collaborate with our partners to identify local needs through their grant applications and from their nonprofit organizations, and our 100% volunteer-administered public health foundation administers those monies as requested. Our board was created in 2018, consisting of a culturally diverse group of people. We represent communities from all over that geographic area that I described. And put that geographic area in context, it's the same distance from Victoria to Duncan. It's a huge area, and it's a very spread out population. There are a lot of people needing very specific care. Our board In addition to creating a diverse board, we constantly update ourselves in terms of our commitment to ethical and transparent operations and ensuring that grant applications from all corners of our communities are considered. What we fund, we specifically love cost-effective solutions for these local nonprofits that we want to support as they identify the existing gaps in the delivery of health care. Health needs, a broad term of health care. We're not talking necessarily about medical clinics, though we have, and we'll talk about that in a sec, but we could be talking about a mother's group. We could be talking about a seniors group. Any group that needs funding for whether it be a table to hold meetings or whether it be funding for research. We're behind that. We base our just want to back up, please, Tyler, for a sec there. Thank you. We base our interaction on a rich history of partnerships. Now, you're sitting in the community hall here of our community. As you came in this afternoon, you saw all the groups that are operating out there, the food bank and other groups. This community is about partnerships, and the rich partnerships that we've been able to establish with various groups has been the backbone of our ability to listen and engage. And we want to continue to incubate and foster those relationships. The key there is the regional network. And I can't thank Mary enough for what her group's done. They've inspired us to be that vessel to raise funds for some of those projects. Thank you, Tyler. On to the next one. Some of our existing grants that we've been able to provide to the Sooke Shelter Society for mental health services for a lot of the people experiencing homelessness, whether it be mental health or addiction. That was a no-brainer when we saw what Sooke Shelter Society was doing. Other opportunities came when we were made aware of some of the challenges that Ayr Manor was having with their population, acquiring a bladder scanner so that their residents could be provide a better point of care service, more accurate opportunities to avoid inappropriate catheterization or to be transported by ambulance to hospital only when necessary. That helped keep those people in community and keep them out of harm's way. Secondly, our third most recent significant grant was for family counseling services at Sooke Family Resource Center. That's a huge area, and I believe it's been mentioned at least twice today in presentations. It just is so important what goes on at Family Resource Center. And then our last major grant recently was for an interpretive EKG to the West Coast Family Medical Clinic. Prior to that, their access to that simple piece of equipment was non-existent, and they had to rely on either calling in an ambulance or referring people to Life Labs when they were open. On to the next slide, please. Thank you. So we have two basic silos for funding. We have one for mental health and people with mental health and disability issues, and we have another for general health-related needs. We have recently started to earmark some of those funds for certain projects when donors wish to have that done. And on that note, I should pat ourselves on the back that we were able to impress a family in the community recently that a most substantial family endowment was engaged to us. So I would like to tell you in closing that our health foundation is owned by every one of you in the room. It's a public health foundation, and we're open for business. I recently had a tattoo on the back of my neck with QR code, and you can come take that. It'll take you straight to the donation page, but that'll be outside because it would be inappropriate in a setting like this. Thank you so very much.
Thank you, Mary and Chris. I'll use this so people can hear me. Thank you, Mary and Chris, for once again emphasizing the importance of working together. So we really appreciate you being here and speaking to us from the community's perspective. As a board and organization, we deeply value our community partnerships. Thank you for coming today and for the great work you are doing in your community. We are running behind, but I still want to give people an opportunity to ask questions, so we're going to extend the closing until 4:15. So if you have questions, please put your hand up. Keep the questions really brief so we can get as many questions in before we adjourn. We have one question, I think, that came in via email. And Marco, maybe I'll just turn to you while people are thinking about their questions. The question was, when are there going to be more medical services and a medical building in Sooke?
Yeah, thanks, Leah. That's a great question, and I'm going to build on Mary's excellent presentation and the work that the Sooke Regional Community Health Network is doing. As we've identified, our population is growing here quicker than it is anywhere else on the island, and in fact, some of the fastest growing communities within the entire country. Even though we've added resources recently, counseling and mental health and social work and nursing resources through the West Coast Family Medical Clinic, we recognize that we need to do more. So our work right now is in partnership with our key partners, like the Sooke Community Health Network, like each of you, to be able to identify what our path is. We know we need to expand. What exactly that looks like, we're actively planning on that. We hope to provide more information here in the coming months and over the next year, but I can assure you that we are actively working towards that. Thank you.
Thanks, Marco. So we do have a roving mic, I think. Is that correct? Thank you. So I think you have someone in mind for the question, so thank you.
Testing? Okay. Yes, well, good afternoon. I think this is a wonderful forum. I really appreciate you taking the time to come out here, and also your use of technology. I was actually able to follow on live on YouTube and see the slides. So it's a great process. And nice to see you again, Marco. We met at a party this year, so nice surprise. Anyway, my question, first a little background. I am a volunteer board director of Sooke Elderly Citizens Housing Society, which everyone knows as Air Manor. Sometimes forgotten in this community because we are pretty low key, but we're just around the corner here. We're one of the largest employers in town. We have 96 people on staff. We have 76 beds, and we are funded primarily by VHA for about a $3 million payroll. So we put a lot of money into this community. Our question as a board is, are there any plans for adding additional long-term care facilities in Sooke? We've seen the growth, and we love the idea of being able to keep people at home, but I haven't heard anything about that. We have a lovely campus here that's got space. There were plans a number of years ago for possible expansion, and they have been shelved. So my question to the group is there something we could do to move that along as a board, and who should we work with?
Thank you. Kathy, I'll ask you or one of your staff if they'd respond to that, please.
Thank you for the question. And as I said earlier this morning when we met with Community Health Services, there will never be enough long-term care beds to deal with our aging population. So it's a very important question for us all as a society to ask. We have been invited by the Ministry of Health to submit business cases for replacement beds, some in the West Shore, some in Nanaimo, and some in Campbell River. So we have heard back on the West Shore, but I would ask Marco, who's the clinical operations vice president leader for the South Island, specifically about Air Manor and this particular community.
Yeah, thank you, Phil. Good to see you again. Cheers. And as Kathy's identified, we recognize that we have probably our biggest growth area that we need is in long-term care. At any given day, we have between 10 to 15% in some of our hospitals across the island, even approaching 20% of our population that are in our hospitals could be better served in a long-term care facility, and we recognize that. So as Kathy has identified, we have been asked by the ministry to submit proposals for the Western communities. What specifically that looks like for Sooke and Air Manor, I think Phil would love to have that conversation with you directly to be able to identify that, but we are recognizing as well that there needs to be growth here, it needs to be local.
Thank you.
Hi, thank you. My name's Mary Brooke. I have a publication called Island Social Trends, and I did live here in Sooke for 10 years and developed a local newspaper, so I'm quite connected with the community. I am concerned about the comments made about the mood and anxiety disorders, the level of those among youth in Sooke. And I'd like to, so a two-part question. One is, what is your collaboration with the Sooke School District 62 and what they are doing to connect with youth on that level? And also the broader aspect of Sooke actually being quite remote from the rest of Greater Victoria. And not only is that just about services available during the day or the week, but a lot of parents go into Victoria to work, and the children do feel isolated out here. And that's a substrata of your problem, which I haven't really heard any detailed response to that. So that's, do you want to?
I think I'm going to ask my public health friends to speak to that. But I will, your second point on, I think this is why partnerships in communities are so important. Who knows what the needs are better than the people who live here? And if there are kids home alone and are feeling disconnected, then what is resident here in this community that can be pulled together to make them feel connected and safe? Yeah, so it's a very good question.
Yeah,
Murray.
it's a very good question, and I, would like to talk with you afterwards about that second question some more, just to see how we can look into it. But with respect to the first one, certainly youth anxiety and mood disorders are a concern, and for the whole population during COVID, we did see an increase, and I think that trend was going upwards even before we saw COVID. But certainly for youth, adolescents, young adults, the trend was even more substantial. And we've got that documented from the COVID survey work that I was mentioning. So it does need investments. We are at the table with the Sooke School District. I mentioned the Village Initiative. I think that is how we approach this. We need to have investments, upstream investments, to make sure that youth are resilient, that they have the capacity to deal with a range of stressors, and that they can recover from stressors that come on. So our work is with our community partners in terms of addressing that. Thank you.
And I was also wondering about your data that you collect back and forth today. You've mentioned West Shore and Sooke, and sometimes the stats are combined, sometimes, but they're very different regions, different growth dimensions, different level of collaboration. It's actually much higher in Sooke than it is in Langford, for example. But so I'm just wondering, do you separate out your data for Sooke from Langford-Colwood when you're making decisions for services and collaboration in this area?
Great question. Sounds like you know your data, and yes, we do when we can. We have some data that we can only report on or aggregate up to the local health area, which includes Sooke and West Shore together. There's other data that we can break down to what's called the Community Health Service Area, or CHSA, which would be Sooke separated from other municipalities. Sorry, is the mic on still? So yes, we do it when we can. I didn't break it down too much today. I had a couple slides that were looking specifically at Sooke, but mostly I was pulling data together for Sooke and the West Shore just because of the time we had to look at this. But we can certainly sit down with interested parties and look at what data we have specific to Sooke and go over that. And even, for some data, like I was mentioning the early development instrument data from UBC, from the Human Early Learning Partnership. we can get down to neighborhood level with that. And we do see high levels of vulnerability or higher levels of vulnerability in children in some neighborhoods compared to others. So if there's interest, and yes, we'll work with our community partners to look at those data.
Thanks, Mary.
Good afternoon. It was very encouraging to hear you talk about partnerships. But I would like to ask for a minute about these partners. Many of them are social services organizations made up of volunteers. And although they're partners, they're fundless partners. They're partners without funds. And I'm just asking, have you thought of changing the funding policy? Because the way you fund these organizations, in many cases, are your frontline service providers. And they should be looked at as that and get proper funding. Right now, they work for grants, just as it was said before. Here's a link to go after a grant, and so everybody goes scrambling after grants. And many people, for example, one organization I know last year had $400,000 in grants. This year it has $125,000 in grants. What does it do in between? It actually has people that are being paid that they have to say goodbye to, and it's a continuous time of people scrambling, and it's happening at the Victoria level across this whole region. So I'm just asking, is there a way that we can redo this and rethink this whole funding process, because the grant process is not working and won't work until we find these and see these people as frontline service providers. Thank you.
No, thank you so much for that question slash comment. And we did hear that at lunchtime as well. This whole system's being held up by volunteers from a social safety net. You know, we're highly dependent on that volunteer workforce, for lack of a better word. I know we have community health grants. We also have contracts with various nonprofits. There's various ways that funds can flow. I think the challenge that we have is the cadence and the annualization of a granting process. And so those are the things we can look at differently, is how can we do multi-year funding through a granting process so that it's not every year and everybody needs to do that work. I know many of what I would say fund holders are struggling with this question. We don't want, I'm on a board of a foundation-like organization. We don't want those volunteers to have to spend all their time doing paperwork and submitting for grant applications. But at the same time, when you've got funds that you're responsible to report on and report to, you need to have some kind of mechanism around that accountability. So that is the challenge, and whether it's the annualized process or if there's a way we can move that so that it's less burdensome and we are still able to show, report back to our funders where the money's going. I think that's trying to find a better balance there, and respecting the time and energy of the volunteers who are we're so dependent on.
Hi. As a mother of 3 and a grandmother of 9 and 7 great-grandchildren, I'm a lot of exposure to young people and the anxiety and things, and I really wish the communities and the media would stop the sky is falling and saying do your part, because you are putting anxiety on the children, and that has to stop. That has to stop. I hear it from my grandchildren, and it has to stop. That's where the anxiety is coming from. And the other issue I have is with health. Growing up, I'm a little older than a lot of you, but growing up, I was raised on a farm, and I was raised with good food, and I am a farmer, and I grow good food. And I don't hear any talk about nutrition and vitamins. When in the 50s, we found out that in the wintertime, we don't get enough sunshine, we don't get enough vitamin D, and cod liver oil was shoved down our throats. But we don't hear that. We're not getting that information, and we're not getting proper nutrition into our children, and that's part of the mental health and depression as well. And any more fast food restaurants come, I'd say, blow them out of the water. We got to get rid of that kind of situation. We have to teach our children to eat properly, and our adults to eat properly. And I would like to see more push on that in our health system rather than vaccinations and all that sort of stuff. Flu season, take your cod liver oil, get outside and play, and eat your good food.
Thank you. And we actually, when we met with the community health center, toured the community health center today, we heard about the impact of having a dietitian on the team. And I think you're right. Like, it's the holistic view of that team-based care. Moving beyond kind of episodic to upstream, exactly as you've said. So thanks for the very important reminder of how we can take care of ourselves.
Test. Hi, I'm Cindy Andrew, and I have the privilege of working with this multi-sectoral network called the Village Initiative. Also do a little bit of work with Sooke School District. But I really want to pick up on the upstream comment, as well as the comments I've heard around the investment to grow services for the called for shared use spaces. So one of the priorities that Murray alluded to of the Village Initiative is around addressing, frankly, the urgent need for space for service providers, who for years now, and Island Health is one of them, for sure, but there are many others who are eager and ready to redeploy resources, and substantial resources, to our community. So we invited them to do a survey, and we said, please only do this survey if the only barrier to providing more services to Sooke and West Shore is the lack of space to actually do it out of. Okay? And we had a good number of community partners respond, eagerly saying, not only do we have some operational, so many of them don't have, like Island Health, I believe, you don't have the capital to build, but you're interested in 5, 10, 15-year leases. You have staff ready to redeploy out here. So, I guess this is more of an encouragement than it is a question, to say, as you move forward, if you can please consider the possibilities of shared use, investing where we can so that we have public dollars for public spaces for public good that meet a variety of needs, including so many of the upstream needs that have been touched on today. So, food for thought, and thank you for your time and your hard work in your governance role.
Thank you for your comments. A couple of times today, people have talked about thinking outside the box, because this healthcare system has existed for a long time, and we need to change the way we do business. So your suggestions are really appreciated, because we do have to be different in the way that we deliver services.
Hi, it was my question that came earlier, but didn't get an answer that really made sense for me. So I'm acknowledging that you all work very hard. You get a lot done, but I'm wondering, at what point, is it a number of population for Sooke that we get a hospital? When? I mean, my doctor wanted to come to Sooke with her spouse, a doctor, but she can't afford to run her own separate practice, start a new clinic. Expanding our clinic is good. Expanding services at Air Manor is good. We need emergency services. We need walk-in clinic for anyone to come in, not just the people who've already seen that doctor or that practice. We need a hospital like Saanich Peninsula has, and their population was smaller when they got theirs. When do we get ours?
So I'm probably not going to be the bearer of good news. We're actually trying to create what I would call a network of health services that are not hospital-based, because we know that it's not sustainable to keep building more hospitals and hospital beds. We actually are really struggling staffing a 24/7 operation in hospitals. People are choosing to work differently now, working night shifts, weekend shifts, rotating shifts. It's very difficult. That said, you're absolutely right. You need access to a community health center that has urgent care, that has ongoing longitudinal primary care, that has community health services. So if that's how we reframe a hospital for this community, I think that's the conversation we're having, is in the context of a community health center, what are the services that would best meet the population's needs? But I'm afraid building new hospitals that are like the hospitals we've built in the 80s and 90s are not likely to happen in communities where we're already struggling to staff the ones we have.
When we get our community health center in Sooke, and a proposal is due December 15th, so we're drastically trying to get all the information to get that done. We are looking for new doctors. We are needing new doctors to come and work here, and we will be providing the place and the overhead and the structure in which they can work, so they're not having to open their own business. That's what we've heard loud and clear, is the doctors don't want to do the business of running the place anymore. They want to be doctors. The urgent care that we will be providing out of the clinic is for the entire community, not just for the members, not just for the clients of the existing physicians, but will be for the entire community. So fingers crossed, and give us all your support to get the funding from the Ministry of Health and Island Health to get this center up and running.
So Mike and I are having sign language here. This is going to be the penultimate question, so one more after this. Have you got a, go ahead, yeah.
All right, good afternoon, panelists and fellow community members. So I actually have 8 questions, but I've consolidated down to one that hopefully you guys will be able to answer. But I'm not hopeful. Today you've spoke many times about partnerships and mental health and addictions and youth and seniors. From my experience within the system, with my family, friends, colleagues, our system is designed for the newly bred and the nearly dead. What about from ages 15 to 50? That is a huge lacking area, both within the mental health and addictions, addiction support, primary care. For example, there is a youth that had to go to the hospital for mental health not too long ago, very good friend of mine. They spent 24 hours in emergency waiting for a provider to come down and assess. Then it was another 24 hours for an assessment. So you do speak many times about the mental health, but there is such a demand of appropriate care. Not just lip service of saying we're trying to get these providers in. Well, the providers that are here, you say evidence-based procedures, evidence-based quality of life. Sorry, I lose my words once in a while, I apologize. However, not every evidence-based is appropriate for every situation. So, with that being said, constantly between Island Health, BC Health, Canadian Health, at a federal level, everybody is linking in mental health and addictions, mental health and addictions, mental health and addictions. Mental health may be part of addictions. Addiction may or may not have an aspect to mental health. That is a barrier to accessing proper care. As well, what are you doing about, or what are you planning or discussing or potentially bringing forward in conjunction with the health minister community consultations in dealing with age 13, 14, 15, providing the care, because counselors have been out of school, are now taking out of schools. Last year at the middle school here, there was a stabbing because there was a kid that was bullied. How are you going to address this actual need? And how are you going to fill the need from age 15 to 50 for removing the barriers for mental health care and for regular primary care for everyone?
I don't have an answer, I'm sorry. I think the challenge of that youth, we find in the health system, part of the challenge is we're fragmented. And I'm probably speaking to people, I'm stating the obvious. Having various ministries holding accountability, so Ministry of Children Family Development has certain accountabilities for care for youth in the community. The health system has responsibilities for care for youth in the health facility. That doesn't serve youth when you're trying to negotiate between two teams. So we've really been working, and I know our colleagues in mental health substance use have been working with MCFD to say, how do we use a principled approach where it doesn't matter where the money's coming from, that we put the wraparound services around that youth. And it's not easy, and it's actually on a case-by-case basis is how we are working through that now. So you have raised an absolute gap in this system. The other thing I think that you speak very passionately and clearly about is the fact that our system has standards and protocols that are kind of, I would say, ways that we standardize care. And we're humans. So sometimes that individualized care plan takes longer and it's harder to access because we've created pathways that are standardized. And it really can be very frustrating when those individual needs are not factored into that care planning. I know that our team is highly committed to youth. We see it. We know that we are caring for youth with complex mental health and substance use needs in a way today in facilities that we haven't had to do before. And so that is not, as Leah said, we have hospitals and health system that was designed for a point in time, and we're not in that point in time anymore. So that is the challenge that our teams face as people are in emergency or trying to be admitted to an inpatient bed, and we don't necessarily have those inpatient facilities set up. So there is a lot of work for us to do in that area.
The only thing that I have one small question and caveat about with regards to that is that at 13, a child is responsible for their health care. As a parent, we can't have access or knowledge unless the child allows us to. I have a great relationship with my kids. Many other parents have a great relationship with their kids. Many parents don't. Many guardians don't. So that is a huge access. So if a child is suffering, we're not allowed to know about it. So it's like you said, that there is different ministries, there's that huge disconnect that is in between there that's causing a major rift, and kids are getting lost, people are getting lost, and from that point, it's going up unto the 25, you know, the main demographic for where the opioid pandemic, the illicit drug and toxic drug supply is happening, because they have been left behind at that age group. Thank you, ma'am.
Last question? Okay.
Last question.
Did you want to be on the live stream?
Sure. Sure. Thank you for your work. This is a very narrow question, so it shouldn't take long. Given that we've known for many, many months that the COVID-19 vaccine does not prevent transmission or infection, why is Island Health still requiring patients to show proof of vaccination to go in and see their loved ones in the hospital? And if the answer is that's a provincial decision, what is Island Health doing to push back to rectify that gross injustice for both the patients and the families?
Thank you. Yeah, thank you for the question. And I know our medical health officers have been working tirelessly to advocate for the review of the evidence that substantiated that provincial health officer order. That order was put in place prior to any, actually right after the first COVID vaccine dose. So we know a lot more about this virus now. So you're absolutely right. And our team is very much working with Dr. Henry on that policy and making sure that the evidence is being brought forward.
Okay, thank you very much. This is on. As a governance board, we are accountable to you and the people we serve in the various communities we provide care in. And that's why it's so important for us to provide opportunities like this to hear from you. And I'm sorry that we're running a bit over time and that we've had to limit our question time. But thank you to everybody who asked a question and to those who submitted them from the live stream. Thank you to Kathy, Murray, Sarah, Mary, and Chris for your presentations. They were excellent. And with that, I'm going to draw this to a close, and thank you for taking time to join us today.